are your thoughts on treating high cholesterol with medication? I'll tell you that there is huge controversy in the medical profession around cholesterol. On one hand, you get doctors who say that every single person should be taking anti-cholesterol medicine because it prolongs your life, it prevents a heart attack, it prevents a stroke, it'll prevent your cholesterol from going higher than it should be. And on the other extreme, you've got doctors who say that there is no solid scientific evidence that cholesterol is the culprit causing heart attacks and strokes and vascular complications. That in fact there are other factors that are responsible for all of those complications, and that cholesterol medication is evil, causing horrible side effects like type 2 diabetes and dementia. So there's a huge discrepancy between the two extremes of opinion. I sit somewhere in the middle where I assess an individual's risk profile, and then we come to a decision around whether statin therapy is appropriate for that particular person. But the one thing that we know for sure is that vascular complications like high blood pressure, type 2 diabetes, heart attacks, strokes, dementia, peripheral vascular disease, all of these conditions that are associated with or worsened by high cholesterol can be treated naturally with lifestyle interventions, meaning you don't have to rely on medication to treat these types of conditions. Let me illustrate my point with a case. Andrew is 58 years old. He came to see me because he'd recently become a grandfather, and it was a life-changing event for him. He was absolutely in love with the new little person, and he wanted to see her grow up. He was scared because his father had died at the age of 59 from a sudden heart attack. And Andrew was starting to experience the occasional chest pain. He was feeling very tired and he was feeling very short of breath. So having a new grandchild, thinking about his own age in relation to the age at which his father had died, and now this constellation of worrying symptoms drove him to come and see me. Now, Andrew had quite a stressful job. He was the COO of a big textile factory. So he was sitting a lot during the day. He had high levels of stress. He was in meetings all the time. He did quite a lot of traveling. He had a very sedentary routine, and he was smoking between 20 and 30 cigarettes a day. When I asked him about his nutrition, there were also some worrying factors there. For breakfast, he would have coffee with 3 sugars, 2 slices of white bread toast with butter and jam, and he would have a glass of fruit juice. At tea time, he would have chocolate digestive biscuits, 2 cups of coffee, each of which had 3 teaspoons of sugar in them. At lunchtime, he would have a white bread sandwich with cheese, mayonnaise, and pickles. He would have a couple of chocolate cookies, and again, he would have 2 cups of coffee with 3 teaspoons of sugar each. At tea time, he would have chocolate chip cookies. His coffee was necessary, 3 teaspoons of sugar again. And on arriving home in the afternoon, he needed his cold beer. So typically, he would have 2 cans of beer and a packet of crisps while relaxing in front of the television. Dinner was sort of a traditional home-cooked meal, based on rice or potatoes or pasta, protein and veg. But after dinner, he would always need something sweet, usually a chocolate or some ice cream, and he'd have another beer. And typically, just before bed, he'd have another scoop of ice cream. So Andrew's nutrition intake was not particularly great. When I examined Andrew, there were a number of worrying findings. First of all, I could see that he was physically unfit. Just talking to me caused him to be quite short of breath. He was definitely obese. His waist circumference was 130 centimeters, which is way over the limit for safety as far as inflammatory fat is concerned. His blood pressure was high at 155/95, and his resting heart rate when he was just sitting allowing me to examine him was 96 beats per minute, which is really high. We did an ECG test. This is a test that looks at the electricity function of your heart, and we can pick up if your heart is having any problems with rhythm or beating or any issues with strain on the heart. And we saw on Andrew's ECG that there were indications that his heart was under stress. We decided to do some blood tests, and his results showed very high levels of inflammation. His blood sugar was in the pre-diabetic range. He had a very high uric acid level, which is very inflammatory and a risk factor for heart disease. His cholesterol profile was awful. He had a very high bad cholesterol, a very low good cholesterol, and his blood fats, triglycerides, were through the roof. So Andrew was in significant trouble. I decided that I needed to refer Andrew to go and see a cardiologist. It wasn't safe for me to say to him, let's just start with lifestyle interventions, because he had a number of significant risk factors and he had symptoms that were suggestive of strain on his heart. The cardiologist confirmed that Andrew had significant buildup of plaque in the blood vessels supplying oxygen to his heart muscle. So there was definitely evidence that Andrew's heart was not getting enough blood supply and he was at risk of having a heart attack. But unfortunately, the damage to the blood vessels was so severe and tricky that the cardiologist could not open the blood vessels with stenting or ballooning. So instead, he had to prescribe very heavy doses of multiple medications, medicine to lower blood pressure, medicine to lower heart rate, anti-cholesterol medicine, and blood thinners, all of which were there to try and optimize heart function and to prevent a heart attack from happening. But Andrew came back to see me after he'd seen the cardiologist, and he said to me, Karen, if I have to live with these side effects, then I'd actually rather have a heart attack and die. The anti-cholesterol medicine was giving him extreme joint stiffness and pain. The blood thinners were causing him to bruise, and the medicine to control his heart rate was making him even more tired and lethargic. So we had quite a serious conversation about his level of commitment to make lifestyle changes in order to reduce his risk. And he said to me, I'm super motivated. Let's start now. So I consulted with both Andrew and his wife, because the wife is always super important in terms of nutritional planning and implementation. And we agreed as a team that we would give Andrew 3 months to make the necessary changes, and we would monitor him closely along the way and make sure that we were not in trouble. And the strategies that we agreed on were: number 1, he had to cut down or preferably stop smoking. This was probably his most important risk factor for the plaque that was accumulating in his heart blood vessels. Secondly, I suggested that he follow a low carbohydrate Mediterranean diet. Very good to regulate his blood sugar, excellent to help him lose the weight that was around his belly, and particularly good for inflammation. I asked him to stick only to 3 meals a day, no snacks in between meals, and I asked him to cut down to 1 beer a day from his usual 3 to 4. I referred him to go and see an exercise physiologist to help him with a specific structured training program to improve his physical fitness, to help train his heart, and to help him to lose some weight. I also asked him to do a sleep study because he'd mentioned that he was a champion snorer, and his wife had complained that his snoring was driving her crazy. So the sleep study confirmed that Andrew had significant sleep apnea, which is also a risk factor for heart disease, because if you're not breathing properly at night, that impacts on the oxygen supply to your heart. So we helped Andrew with a CPAP machine to improve the oxygen delivery to his heart, especially at night. Now, after 3 months, Andrew came back to see me for a reassessment. He had lost a significant amount of weight. You could visibly see that his belly had shrunk. He was not short of breath. He mentioned that his energy levels were fantastic. He was able to concentrate much better at work, and he was feeling much more optimistic and productive. The exercise program was helping with his energy levels. He had not only cut down on smoking, but he decided to stop altogether, which was remarkable, a fantastic achievement. His blood pressure was better, and when I tested his blood sugar, it was perfect. When we repeated his blood tests, we found that his inflammation was much better, his uric acid was much better, his average blood sugar was much better, and his cholesterol had improved significantly. Now remember, all of these improvements came about as a result of lifestyle change. Andrew changed his behavior. He was eating better, exercising, sleeping better, and he had not been taking any of the medicines that the cardiologist had prescribed him. After 6 months of our strategy, he had a follow-up visit with a cardiologist. Now, I remember this clearly. The cardiologist phoned me while Andrew was at his clinic, and he shouted at me from a dizzy height, "How dare you stop the medicine that I prescribed for this patient? What were you thinking when you stopped his medication? Do you know how dangerous it is?" And then his tone changed completely, and he said to me, "Your patient is doing remarkably well. He passed his stress ECG with flying colors, and his heart function has improved dramatically." So Andrew's case just goes to show that lifestyle intervention has a tremendous power for improving cholesterol and the other risk factors for heart disease. But besides that, we can save people from the horrible side effects of medications, and we can increase the health span. That is the years of life that you have when you are healthy and happy. So in Andrew's case, I am optimistic that he will not only enjoy many years with his little granddaughter, but that he'll live to see more grandchildren grow up, and he will have a rich and happy life going forward.